Welcome to the number one show and the source of truth for all things MedTech. Here, we reveal the secrets and stories behind the investments, science, and commercialization of the MedTech industry. Every week, we'll take you on a wild ride with the biggest names in the game, from entrepreneurs and investors who are shaking up the market to healthcare providers who are revolutionizing the way we think and practice medicine. So hold on tight and get ready for a journey like no other. This is the state of MedTech. Hey everybody, welcome back to the show, and we got another venture capital episode. This time with a VC who's actually quite unique in the sense that he used to be a pro basketball player, and aside from that, has a remarkable career. And so had to have him on, but more importantly, his VC firm has such a fascinating investment thesis, and that's Mr. Assaf Barnea. Mr. Barnea is a seasoned entrepreneur and a venture professional, and he leads, since its inception in 2014, Sanara Ventures, which is a healthcare innovation fund backed by Philips and Teva Investing, specifically in digital health, medical devices, and bioconvergence technologies. That latter one is the one that really caught my eye. He's also the founder and managing partner of Sonar Capital, which is a new follow-up fund for Sanara Ventures that focuses on A and B round investments in healthcare-related technologies. Now, in relation to his role at Sanara, Mr. Barnea chairs the Life Science Advisory Board at the Israel Export Institute on behalf of the Israeli government, which essentially promotes and advances the export of Israeli technologies in medical, biotech, and pharma and digital fields in the global markets. If you are unaware of this, Israel is a hotbed for innovation, but very specifically MedTech innovation. I think at one point, or if not, it still is, there's, I think, more startups per square mile in Israel than anywhere else in the world, including places like Miami, San Francisco, and other startup ecosystems. Now, before all this, Assaf was also advising the World Bank's IFC venture capital team and is the co-founder of the IFC's Tech Emerge program, which is a unique acceleration platform that connects healthcare startups from around the world with leading corporations and hospitals in emerging economies. And in 2018, Tech Emerge Health has won the World Bank Group President's Award for Innovation. Just a little bit on Assaf's background, just outside of the venture MedTech world. He was a former college basketball player at the famous Seton Hall University during the 90s, where, I mean, the Big East was really competitive, especially back then. But back then, he was part of the team that won the Big East championship against Georgetown in 1991. And he went on also to play professional basketball. So this episode, we talk a lot about not only his background, but more importantly, Sanara Ventures' venture thesis and investment thesis, the things they like to invest in, and a lot of Assaf's philosophy when it comes to innovation in the space. It's a great conversation. I really loved having him on the show, and I kind of want to have him back on to talk more specifically about investments in the world of bioconvergence. Now, before we get into the episode, a couple things I want to remind our audience about. Number one, if you are a founder or maybe a VP of sales or VP of marketing, we all know the most important thing for a company after you raise money is actually driving adoption of your technology. So finding those early adopters is key. Now, the problem with that is it's not like the old way 10, 20, 30 years ago where it was as simple as figuring out, well, who speaks the most on podium? Because that's often not the best adopter for your technology. This is where we need data to enable our decisions. Again, another problem is that a lot of the databases that exist out there that tell you about a physician's procedure history, their societies they're a part of, all the information you need to target a physician, they cost a lot of money. And a lot of times in my experience, they've often been very clunky. I discovered this early stage startup called Alpha Sophia that specifically their entire thesis is around early adoption and early adopters. Their platform is very simple and easy to use, really nice UI, and you're able to search through procedures and specialization. You're able to access contact information And this was something that actually got me quite excited. Their team also plugs all these clinicians, right? So you can, let's say, do a search for the urologist with the top procedure flow in, let's say, New York City. And it also shows their Twitter profile, their Instagram profile, and LinkedIn profiles. And I think that's very important because when it comes to finding early adopters, a lot of times you can find diamonds in the rough who have good procedure volume, but in fact have really strong social media presence, which helps drive product awareness and thus product adoption. So the best part about all this, their pricing is insane. Their pricing for using their platform is as low as $300 a month. And just for being a listener of this show, they have a fantastic offer just for you. You can get 3 free profiles. So you go and sign up with them just to get a quick demo. You go to alphasophia.com/Omar. That's ALPHASOPHIA.com/Omar. Submit your information. Their team will reach out to you. You get on a call. They'll open their platform up. You tell them the procedure, the type of the physician, whatever it is you want to see, and they're going to give you 3 profiles for free without having to sign up or give anything up or get a credit card. You know, a lot of these platforms require you to do all these things. They're going to give that for free. Okay. Highly recommend you check them out. And lastly, if you are in fact a founder, and I know how difficult it is right now as a founder to essentially do the thing that you're supposed to do, which is driving awareness with the market to attract investors and also get some commercial pipeline going, right? It's almost like a juggling act if you already have so many things to do already. Well, I work specifically with early stage companies and their CEO and their leadership team to figure out how to use social media in an effective and scalable way to attract both investors and clinicians for commercial pipeline. I worked with a variety of companies, but here's one that you might be aware of, which is Moon Surgical. Moon Surgical is a surgical robotics company out of France. They've had wonderful success in raising their Series A and B. And here is what their CEO, Ann Osterwood, and their Chief Strategy Officer, Jeffrey Alvarez, had to say about the engagement.
The results were amazing. The traffic that was driven to not just our company site, but also our personal sites, over 300% of what it typically was on a regular basis while we had the campaigns going. We know the results were being achieved, and that's why it's so great to work with Omar.
The level of inbound interest we were getting was substantial, especially from investors. It has only been growing since then. So we've been leveraging Omar's work and what we learned from him continuously in the past 2 years.
And what were the specific results? That spring that we worked together, they were able to raise a $31 million Series A with GT Healthcare, and then a year later, a $55 million Series B with Sophie Nova and NVIDIA leading the round. Now, I cannot say that we directly contributed to that. That would be foolish. But what I would say is that if you're a startup founder and you want to put you and your company in the best position possible to attract investors at scale, to attract commercial pipeline, and give your company a fighting chance, please reach out to me. I want to work with you. Go to khateebandco.com and you can schedule a time to meet with me there, or just simply shoot me a message on LinkedIn. Now, with that being said, let's get on to our episode with Assaf Barnea of Sanara Ventures. Enjoy. Welcome back to the show, everybody. And we have another great guest, somebody who I've been following for a long time on LinkedIn. And, big shout out to the VP of growth over at LSI, Henry Pecky. We were catching up and he was speaking extremely highly of him. I'm like, I got to have him on. So I'm very happy to have Assaf Barnea on from Sanara Ventures, a really interesting fund. And equally so, Assaf has like a really interesting background. We're going to get into it in a moment. But Assaf, thanks for joining. It's like late over there in Israel, so I appreciate it. How are you doing?
I'm good. Thanks for having me.
Absolutely. I understand you just got back from like this trip in Tokyo. How was that, by the way? I've always wanted to go to Tokyo.
It was amazing. I mean, I took my 2 boys, both are like quite young, 12 and 10. And for me, it was the 5th time in Japan, but I love the country and just to open up and be open up to see different cultures. And Japan is like totally different. I think it's not even Asia, as they say. So my kids were amazed. And actually the combination, we're going to be talking about convergence. We did even see in Tokyo, the Manchester City plays against a local team. So it was a combination of having a European soccer, which we like, also combined into the Japanese kind of tradition in the national stadium. So it was great.
That's fantastic. Yeah. Well, my I co-founded a software company with a close friend who is Japanese, and I always joke with them, like, man, I have to make my way to Japan. They always say that when you go to Asia, you leave Tokyo for the very end of the trip, because that's like the most, I guess, spectacular way to end. Would you agree with that?
I think, it's there's so much I love Asia in general, but I think really Japan and Tokyo specifically is like, if not mistaken, by the way, the largest city at 35 or 38 million people. I think
It's a lot of people,
even
yeah.
bigger. A lot of people. So it's huge, and each of the sections is so different, and even within the Japanese culture. So it takes more than one trip to get to know and to fall in love. Some people do fall in love immediately, like I did when my first trip took place. But when you get to see the subtleties and they get to understand the culture, it's quite amazing. Really.
Absolutely. Well, before we talk shop, and there's a lot about your fund and the fund thesis I want to cover. I want to cover like a little bit about your background. You have a really interesting background. Like to kind of like jump to it, as they say, like you're a pro basketball player for like over a decade. But before that, I mean, tell me a little bit about you. Like where'd you grow up? What kind of things had an influence in your life? I don't think many people, they go to college thinking like, oh, I'm going to become like a MedTech investor. Maybe you did, but I'm sure that may not have been the route. But what was life like growing up for you?
So actually, I grew up in Israel, in Haifa, in a city called Haifa, which is a twin city to San Francisco, and looks
Great
kind of
city.
alike.
Yeah, I've been to Haifa. It's a great city.
It is, and there's a beautiful mountain, there's a beautiful bay. So it definitely makes sense to be kind of a twin city to San Francisco, even though I know that San Francisco, in my last trip to JP Morgan, was actually providing those evidence that San Francisco is not as it used to be, I have to say.
Yeah, you're right. I second that, unfortunately.
Yeah. But going back to your question, I did start to play at the age of 8 to play basketball. I just, for some reason, it wasn't even a dream to become a professional. I just took it for granted. And, throughout the years, I only then realized, and I've been a professional for 14 years. Then after growing up, I played college basketball for Seton Hall back at the time. The first time we took the Big East championship in the Madison Square.
That's a good school. That's tough to get, like, to be an international player and go play for a Big East school. That's really impressive.
Yes. So back at the time, this was like 2 years after Seton Hall lost in the final in the NCAA versus Michigan, and I was very happy to join the team and actually winning the biggest championship in the Madison Square Garden versus Georgetown with Alonzo Mourning and Dikembe Mutombo, and getting the championship ring, getting my picture in the front cover of the New York Times, the sports section. I mean, this was awesome. Within itself, and then we kept on playing, and we made it to the final 8. We lost to UNLV with Larry Johnson, Stacey Ogman.
That's a really good team. It's a good team to lose to. I gotta say, if you're gonna lose to somebody, that's a good team to lose to.
So eventually, I came back and I played as a professional in Israel in the first division, in the Israeli national team in Europe for 14 years as a professional. But addressing the question which so many people ask me, so how did you become a venture capitalist? So while playing professional basketball, and please don't misunderstand me, like I'm not trying to tease anyone, but it is doable to go to school and to combine even as a professional and taking it very seriously. I did 3 degrees. I did law school, so I'm a certified attorney. I did business school, and I did political science and psychology while playing as a professional basketball. So if I need to encourage someone that combination and convergence is doable, please believe that it is doable. I mean, we can do more than one thing at a time.
I'm very happy you say that, because and I think this is like, it's going to be, I have a feeling this is going to be a big theme of our episode here. But I'm a big believer of this idea of like reading broadly, converging topics. I mean, so for example, you see, I'm here in my library, a lot of people, they ask like, man, there's a lot of like sales and marketing books. I'm like, no. It's like sales and marketing makes like 1 or 2 shelves. A lot of the books here, we have psychology, we have history, we have all these things. And I think that what made me a great, at least sharpen my business acumen early in my career was to read all very broad. And these ideas, they have a magical way of converging, So was that your first time like realizing this idea of convergence? Was like during that time when you were a pro and you're learning? I'm sure like you took things and applied it to your professional career too.
Well, I have to say very openly, and I hope it doesn't sound like as if I'm, bragging about anything, but it's in some cases, sometimes when you shift from one field to another, people are a little bit surprised. Hey, you've been a professional basketball player. How come you decide on my investments or my dream or my startup or whatever? But I have to say that for me personally, I think it's long gone. And now, being perceived now as a venture capitalist for over a decade, maybe close to 15 years, but people do still talk to me about basketball whenever they can, and I get a lot of feedbacks. It's not within my stream anymore as much. It's not as important, but I have to say that there's a bit of a feeling of kind of a guilt to some extent. In the early days when I did a transition and started my career in telecom, in the high tech, before I became a venture capitalist, and doing that transition, like even to some extent an apologetic point of view, that saying, I had to justify and explain how, like maybe I did just now by telling you that, I did law school, I did business school, I did that, in order to justify that I'm not just a basketball player, or I did not just become a venture capitalist by just transitioning because I had money to invest or whatever. So it is part of the process. I think that the inner self needs to feel okay about this convergence of who we are. Eventually, it takes some time. The pathway that we're going throughout the years are those that we need to acknowledge them, not just by being proactively and doing stuff or having such and such missions on our life, but rather look internally and acknowledge who we are, what makes us motivated, what makes us special people, the way that we can bring many different shades and interfaces of our abilities, inside abilities, psychological and others, to be to take them and implement them externally. And this is when I eventually started to kind of not to apologize anymore, but rather just create yourself and invent yourself again and again as much as you can. By the way, just not to shock you, I also did like a TV sports show for 7 years. Parallel to playing a professional, I did a sports TV show, and I liked it.
Really? So you were a TV caster prior to being a pro player?
While being a pro in Israel and traveling to Europe, and I did a TV show, a sports TV show, and there have been days that I've been juggling between having a morning practice, because eventually you are a professional, you have to get to morning basketball practices with the coach and the team, obviously, and then rushing to the TV studio to do the sports TV show, and then, doing some, the law school related stuff. But it is doable. What I'm saying is, then again, I'm not bragging about it. I'm just saying that the busier you are, the more you can accomplish, and not vice versa. The busier you are, you can squeeze it all and make it happen.
No, absolutely, and I'm glad you brought this up, because like when I was looking at your background, I didn't bring it up because some people there's some people who are sensitive about their backgrounds, and so I usually leave it to them to bring it up. The reason why I wanted to bring it up, because I said, oh, this makes a lot of sense. You strike me as a very like down to earth and humble guy, so I'll brag on your behalf. Like, a lot of the things that you've accomplished and done is nothing short of very impressive and amazing. I think Israel as a country is probably very proud to have you as like a citizen, and of course as a leader on the innovation side we'll get into. But there's this concept of a talent stack. This is from an author and also a mentor of mine, Scott Adams, where if you take different talents, like maybe you're okay at speaking, maybe you're okay at writing, separate, you're not going to be very world class. But when you stack all of these things, you have this very unique talent stack. You're like one and only. So for you, you played professional basketball, which aside from the physical attributes, there's a lot of things you learn when we play collegiate and professional levels, like the discipline, the habits, mindset. I think mindset is like the most powerful thing you get. Yes. Law school, all these different things. So this really impressive talent stack. This is like one of the reasons why I wanted to have you on the show. Is like when I was researching, I'm like, this guy's got. We'll talk about his fun, but we got to talk about a little bit about his background.
And I think this is a very good point. Actually, one of the things that, and I'm very open about it, I've been like that throughout the years, is you mentioned psychology. I've been telling for so many years that I did an amazing process of therapies throughout the years, and not just therapy, but rather psychoanalysis. I did like 3 or 4 years of 3 times a week, like psychoanalysis, getting down deep into subconscious and analyzing dreams, which, it was such my curiosity, basically, to getting to know myself. Now, when I'm talking about, the ups and downs and the the waves that entrepreneurs are being shifted away, the frustrations, the need to address the others and quite listen. People sometimes don't listen. They just like to get, and they, on the way to become a successful startup companies, you truly need to listen and let people talk and understand the use cases and understand the unique business model. Those, I think, to the extent that I can share some of my paths and challenges and ups and downs that I've gone through, I'm okay to talk to entrepreneurs and even indicate about myself some of my issues and challenges that I had to go through. And then you create partnerships. Partnerships are about relationship and about trust. It's the bottom line of everything. You can fall in love with technologies, but if people eventually don't communicate on the same level, and if they don't understand that it's like a bit the yin and the yang, partnership. When we invest $3, $4, $5 million into a company, we become partners. There's no other way to say, but rather get into the interpretation of what does it mean partnership. Actually, sometimes I need you, the CEO, more than you need me, and there will be times that you will need me and my team more than you think. And these are the ups and downs, a dance that should be an equilibrium of understanding who we are and how we act as people. Because if you only maintain on the professional level, execution level, this is my own belief. There's only so much like a ceiling glass that you may not be able to go beyond that. And this is why I think in good cases, it's the bottom line of successful startup companies, let it be in the medical space or let it be elsewhere, that you need to create that connection, emotional, psychological one between the team, between the people, between us as investors, board members, and the entrepreneurship team in order to be really successful.
Oh, 100%. 100%. There's something to be said about, science can't explain everything. So science cannot explain the subconscious. Science can't explain, for example, certain energy, right? This is something, there's a company called the Heart Math Institute. They talk a lot about the ability to get your heart and your brain in sync and creating a certain like magnetic field, which a lot of people, when they hear it, they say like, oh, this sounds like nonsense. No, it really is, and I think that I feel like a lot of, at least here, I'll speak for the United States, entrepreneurship in general can be, and we're going to get into something political now, but whatever. This is why people love the shows. I say things I probably shouldn't say. If you look at the psychology, right? Not male and female, but like masculine, feminine. You and I were men, but we have masculine, feminine points to us, right? Entrepreneurship, for the most part, is a lot of it is very masculine, ego driven, right? With competition, aggressiveness, and everything. I feel like a good balance, though, is to have that feminine side, which is more focused on intuition, right? Which is more getting involved with like the emotional side and asking like really deep questions. I think that the quality of your life is really reflected in the quality of questions you're asking yourself. And it sounds like you've done a lot of that yourself. Would you agree with that?
Yes, I think so. Basically, being a professional basketball player, you get the good stuff and the bad stuff being written on you, like in the papers, on TV shows. When you're in a good shape, people are saying he's in a good shape. When you're not and you're losing your confidence, so this is when you need to really, get to the bottom of things and maintain, hang in there, and not to give up, which is a major part in entrepreneurship, is not giving up. Really, not giving up. Fundraising, not giving up. Looking for the specific use case, not giving up on finding the right strategic partners. It's not giving up. And this is, I'm not saying anything new. It's just a different way to say it. But it's, I think the process that basically, some of the companies may be able to understand, or some of the entrepreneurs may be able to understand, is that, the variety or the ability, like a new CEO of a very early stage company that we put in like $1 million or $1.5 million, they need to do everything. They need to manage the IP, the marketing, the R&D, the product market fit, the reimbursement, the regulation path. There's so much, and that's the beauty, which I love in the medical space, in healthcare, in digital health, or medical devices, or bioconvergence. It brings all the life science behind it. And you are right to some extent. Science cannot explain everything, and science gets you as an entrepreneur to only so much. So many entrepreneurs, they fall in love with a certain technology. I see that day in, day out. And this is unfortunate. And they cannot, and this is where we come in, myself and my team obviously come into play, whereby we need to explain to them that technology and science, let it be science, the best from the best research institute, whatever it may be, does not translate necessarily into a product. And product does not translate necessarily into a saleable, scalable, and sustainable, like the three supermans, the three S's of a successful company. And those, so many entrepreneurs, they think of the R&D. By the way, just the R&D within itself, there's an R and there's a D, and sometimes there's a small R and there's a small D, and then a capital D. And it may take you like 3 to 5 years just to move from an R to a D, or even more than that. And
what are the three? Can you touch real quick? What are the three S's of a successful startup?
So moving from a technology to a product, first of all, and then a product with the right use case, with the right business model. This is a major issue. Let it be in being discussed in digital health. It is not necessarily so much the technology or the application. It is the finding the right business model to justify a sustainable company that doesn't need to fundraise again and again and again. And so many of the digital health companies eventually are navigating their way to find the right business model. So a business model, in order to get there and to justify the existence of the company, first of all, a product, once developing a product, let it be a software or whatever it may be, or a sensing capability, needs to be saleable. First of all, someone needs to pay for that. When you start an R&D, entrepreneurs saying, this is great, we can do that, but it's actually a technology looking for a solution, not a solution that is utilizing a technology to address a true market need. So those are words that we keep on saying to entrepreneurs, as other VCs are doing. But being saleable is one thing. Being scalable, that you can scale with it, and sustainable for a long period of time. If you don't find the right business model, eventually you can come up with a software, be able to sell it for $50,000, $60,000 for any providers. But then you become after 4 or 5 years, you may be able to sell for, I don't know, $1 million, $2 million. This will not be interesting to any of the VCs. You want to build a unicorn, you want to build a company with, 2 to 10 to 20 and becoming a company that you can sell for $200 million, $300 million, the minimum if you can. And this is why, when we work with mostly early stage companies, and this is where we're focusing on seed stage, A rounds and B rounds as well. But these are all early stage companies. This is not necessarily growth capital. So those verticals within the development of each and every companies are crucial to understand and dive deeply into them. Otherwise, if you're missing something about the business model, with all due respect to technology, you're not going to make it. And this is a common sense. Everybody knows that.
Yeah, no, I completely agree. And I think, before we get to, because I want to understand like your transition, like from pro basketball to, the working world and then into venture capital. Yeah. I know you started Sanara in 2014, but I think this is, in my humble opinion, this is one of the reasons why, if you look at the last 5 years, if you look at big tech, Amazon, Microsoft, Apple, Google, they are tasked by their investors to grow. Google's not going to wake up one day and say, you know what, let's start making furniture. Like they got to make a big bet. The big bet is healthcare. And I think that, tech came to healthcare with its tech model thinking, oh, we just have this really, really cool product. That's all we got to do. And a lot of them failed. Amazon failed in a couple of years. Google, I mean, no offense to the people at Verily, it's a great place to work if you're an engineer. In terms of making money and commercializing things, I don't really know what they've done. But now tech is having a second attempt. Amazon acquired One Medical. Apple's, doing these different partnerships. So now it's, having a little bit of a different approach where it's like, it's not enough just to have a really good technology. It's just in any industry, but especially healthcare,
Yeah, I agree. Yeah.
So
this is exactly what I was referring to. It's more than technology, and it's more than a product. It's the eventually the business side of things, and to be creative, try to be creative on the business side and listen carefully to those, whoever is making the decision, let it be on the provider side, let it be on the payer side. Entrepreneurs, they need to truly listen and identify maybe a unique business model, and not just to duplicate whatever was there. This is something that, strong entrepreneurs bring to the table.
I absolutely agree. Just before we transition, I got to just bring this like full circle, because you were saying like great entrepreneurs, they know how to sort of like listen. It seems like ask the right questions to identify things. There is a quote from The Godfather. I'm almost certain it's The Godfather. I got to go back where Michael Corleone was talking about his father. Maybe his Godfather too. And he said something like, my father once told me that the more I understand myself, the more I'll understand the world around me. And at that point, anything is possible. And I think that great entrepreneurs, especially if you look at like some of the biggest ones, like, like Steve Jobs is maybe a good example of it, that this exercising capability of asking yourself really good, hard questions and digging and finding the answer, practicing that on yourself makes it a lot easier for you to do that with customers, the market, with investors. And then you get to the source of truth. That's like the most important thing, otherwise you're kind of being led by either your ego or like shiny objects in the market and stuff. And then I always see those companies fail. I don't know if you agree with that perspective though.
Yeah, I think trying to maintain that same level, there's only so much that we can, think as to ourselves as that we know it all. It's not just that we don't, and we need to listen, but there are always changes in the marketplace. There are always, competitions which we are competing companies, I would say, that we are not aware of. So in some cases we stumble into companies or we meet companies, and they come to us, which is totally okay with that kind of generic approach of, we should do that with, software as a service, whatever it would be, the business model or the technology itself. And venture capitalists like myself would like to find a disruptive technology and disruptive team and really think that this is a diamond. This is truly a diamond that we would like to be part of. And sometimes it takes, like we did just now, an investment in a company that is doing optimization for a company called QLog that was doing optimization of processes in hospitals and turning hospitals into kind of a hospital readiness situation. It has a location kind of a component into that within the hospital, does not connect to the EMR, to the electronic medical record. It's been implemented in like 30, 40 hospitals in Israel. And it took us some time as a team to understand the value and to meet the team again and again and to listen to the physician who is the CEO as well, saying, I went to medical school for 12, 15 years and about 50% of my time, 50% of my time is wasted on filling up the forms and checking up the surgery room, whether it was disinfected or not disinfected. And boom, all of a sudden, after a few meetings, we decided to invest in that company and we thought it could be a diamond. I mean, we need to polish that and make sure that, eventually there's a clear, unique value proposition to some extent of us investing in it. But it's all, as you said, it's about a feeling. There's no certainties. There's no 100%, assurance that whatever we picked will be the most successful company. But it's the gut feeling and the chemistry. And then again, I'm emphasizing the chemistry and the relationship that you can create either as an entrepreneur or as an investor. It's always a dual relationship. When entrepreneurs come to us, I said, you guys should check Sanara. You guys run a due diligence on us, not just we on you. It's a dual communication. It's a dual process. It's like even more than getting married to some extent. It's like getting married has its unique boundaries, special boundaries, but getting into a partnership with a VC for the next 5, 6 years or whatever, the ups and the downs and the various interfaces that the teams need to address is quite fascinating for those who love it, like I do. But it's the depth of relationship that eventually will define the success, aside from the uniqueness of the technology, which is a given, in the early stage.
Absolutely. And probably a good transition. You founded Sanara Ventures in 2014 and
yep.
with pretty impressive joint venture partners with Philips and Teva. How exactly did all that get orchestrated? And why did you pick to work with Teva and Philips? Because at least from what I understand, you guys focus on early stage. So I know you started Sonar Capital, which we'll talk about, but Sonar Ventures, you focus on seed stage companies, specifically in MedTech, digital health, and of course on the bioconvergence side. How did all that come to be?
Israel has, about close to 2,000 life science companies out of Israel, like 1,800 to 2,000 life science, which is a huge amount of companies. And
per square foot, it's a lot of companies. It's a lot of companies per square foot.
Obviously not compared to the US, but you're right. To the size of the density and population and patents per capita and whatever, those are very impressive numbers. And basically some of those corporates like Philips and the others and Teva, even though Teva has both Israeli and definitely a US, been listed both in Israel and US, but it's sometimes those corporates, they like to tap into the Israeli innovation and seeing what's happening on the ground, which is quite fascinating. Some corporate VCs have a charter to invest in like moonshots technologies. I would say, could be 7 to 10 years down the road. Who knows what will come out of it? Nonetheless, some of the other corporates, they would like to see it happening on the ground and being exposed to Philips is doing obviously imaging technology, CTs, MRI, and monitoring and connected care and many, many other things. And basically, back at the time, Philips, as well as Teva, they acknowledge Israel as being quite a unique place to be part of the early ecosystem and the landscape. And the beauty was that actually they were not stepping on nobody's toes. So when you build such a JV, we can say if you have only one player, and companies would come to you, and as an investor, as a corporate, you say, yeah, we put in like whatever, and we get like 20, 30% equity. And they may feel that, you may be kind of planning like not a takeover, but coloring yourself as a under one corporate may be somehow like a threat to some entrepreneurs. As if you complete the R&D with that imaging technology, and you immediately ending up yourself as a Philips, part of a Philips product or a Philips division. I'm just saying this was not the case. Nonetheless, the beauty in both Philips and Teva actually created a balance of, creating a landscape, a platform of innovation, which is quite unique, loosely coupled to those corporates on one side, being able to get their support on drug development and drug, various delivery platforms to cross the blood-brain barrier and deliver drugs to degenerative diseases such as Parkinson and Alzheimer, multiple sclerosis, which Teva came up with the Copaxone drugs like 20, 25 years ago. And on the other, having a device company such as Philips, and now also shifting obviously to connected care and others, which they don't step on Teva's toes. So whatever project that we have invested in, not just synergistic to Teva, not just synergistic to Philips, but also some of those other quite disruptive technologies, like one of the companies that you invested in, company called nanodrops. These are drops in your eyes to replace lenses and glasses, and this has nothing to do neither with Philips nor with Teva. But they did come to us, those entrepreneurs, because they acknowledge that we as Sanara act as a platform of innovation. We give them a chance, we work closely with them, trying to support them. Parallel to that, I've built, and as a team, we built a global advisory board, which I'm very proud. I'm obsessed about knowledge sharing. Truly, I'm obsessed. I don't think that we know it all in Israel. We lack the understanding of a true product market fit in Israel. So we're coming up with the best technologies on one side to some extent, but on the other, as I've mentioned over and over again, hopefully I'm not repeating myself too much, but we in Israel lack the understanding of the US market. And even though it is achievable to address and bridge those gaps, but we need to have the people. And I built in Sanara an advisory board of 117 people from the US, from Europe, from Asia, from Latin America, that we can approach them and talk to them and understand, business models and go-to markets and regulation, and they are assisting us. So I think all in all, it takes a village, as they say, and it does take a village. This is a beautiful sentence. It does take a village to build ecosystem around innovation. Just bringing in capital would not work. Just bringing in good, talented entrepreneurs would not fly. This is my own belief. I'm not saying that I'm necessarily right, but you need to build an ecosystem to support innovation, capital, talent, strategic partners, knowledge, go-to people, and be able to address innovation in a bit more faster way than we typically do, introducing companies and let them hit the wall, knocking on someone's hospitals in Boston, coming in, hey, we're out of Israel, we have this amazing technology, nobody knows them, and they need to prove themselves. But rather, vice versa, if you have someone, head of innovation in that hospital that already knows Sanara, knows that Sanara has been working with Philips and Teva, and we talk to them and we've been communicating, and then we're sending two companies to that person or to that division, it's a totally different ballgame.
No, I well said. And by the way, I agree with you on one on the knowledge sharing, but also on the side of like the partnership aspect. And again, I think like good questions are usually simple questions, and they're usually simple to ask, but they're not easy to answer. It's like, what is a partnership? I think from the entrepreneurial standpoint, a lot of founders and entrepreneurs listen to the show. And the one thing that look, me personally, I've not raised a fund myself, but I've been in the startup world for long enough that I could say that, like, look, if you're going to go get, money's a commodity. I know a lot of founders in this market are like, it's definitely not a commodity, but it's still a commodity. And so I always tell founders, like, look, if you're going to take a check from somebody, it's not just the check. It's like, well, who's attached to that check? Like, what are they going to do for you? Like, when times get hard, are they going to be somebody that you can go and like very openly and vulnerably like get advice from? Or are they going to lift you up? Are they guide you? Or are they going to be a real pain? Right.
Yeah.
And sometimes I think that founders, they're very quick. not just to get money, but it's like, oh, this check is attached to this like really well-known person and that'll help me raise more money. But it's like, well, that check might also come with some things that you don't want to deal with and you haven't like, asked about, right? This is why, like, I think, oh, go ahead. Sorry.
No. Just to comment on that, I think
please,
now it's become, now money is not even commodity. These days, it's quite tough, really, to fundraise. It was a commodity, and I totally agree with you. But the thing is, it's exactly that, that eventually, if entrepreneurs and founders basically just get, money just like that and don't scrutinize carefully enough, it just not just potentially might be stumbling into a wall, but specifically now in this time, people are keep on saying, to LPs and investors in the fund, even myself, these are challenging times. This is why it's actually one of the best time to build good companies, and I strongly believe in that. And it took me some time initially when I heard about it. I was like, it's just an expression. Honestly saying so, I heard it a few times. Only in this circle, only this round, I truly acknowledge why is it, because of exactly what you and I just been talking about. It's a more settled atmosphere whereby it's not just taking money. Like people are scrutinizing one another now. People are sensing one another. People are afraid.
Exactly.
Both to put capital. We put all of the. I don't want to say not just the ego and the bullshit aside. Sorry for saying, but it's the.
All right, you can say that on this show.
But it's the ability to run a thorough due diligence and to think deeper and to take decisions in a different atmosphere, not just run and we have to deploy this capital and let's just do it and whatever, but rather being very cautious brings us all, both entrepreneurs as well as investors, to a different reference point within ourselves, within those partnerships, to deploy capital more carefully and to truly understand what does it mean. So I think there's a different pace of doing those deals now and doing the business, which on one hand, we still need to run to the marketplace and not waste too much money, but structuring the deals, I think it's a different atmosphere. And this is why I think we're more careful these days and hopefully we'll be more successful coming up from that so-called recession or challenging time to a different scale of operation.
Absolutely. And I was going to say, this is going to be, I'm going to just forewarn you, this next question I have, has a little bit of an introduction, but I kind of want to hear you kind of dive deep on this. So one of the things that I find fascinating about your background is that this happened, after you established Sanara Ventures and, Phillips and Teva did the joint venture with you. It was a couple years, I think 2 years later, you became the chairman for the Life Science Advisory Board for the Israeli Export Institute. Okay.
Yeah.
And for those who are listening, I didn't mispronounce that. It is the Israeli Export Institution whose whole purpose is to say, hey, how do we take great companies and innovations from Israel and partner with private industry and export it all over the world, right? Which I think it would be, it's like the best, that must be like the best job to have, because you're essentially seeing so many different companies and you're just thinking, how do we make these global companies, right? How has that role helped you at Sanara Ventures in terms of like expanding the depth and the breadth of startups you're seeing and your skill set? Like how, I feel like those have gone hand in hand so well, but if you can kind of, talk about that, because it's very rare to meet someone who's in venture capital who also holds not only a government position, but like probably the most important position for life sciences in the country.
This is they're all complementary to one another, and I may have mentioned to you, I'm not sure that the things that I was able to touch and really experience. Also, I may have said it before, helping. There was a point of time that I've been helping the World Bank, the venture capital team of the World Bank, the IFC in Washington, of building up innovation platforms like the Tech Emerge platform, which we built in India with hospital being supported by the World Bank, and then we took it down to Brazil in Sao Paulo. So I think that actually brings out not just the perspective, but rather the ability to understand that we need to work together globally. And this is why, COVID took place now, and everybody acknowledged that this is my own belief, that knowledge sharing platforms, not just stumbling into one another in conferences once a year. There are technologies that are supportive of knowledge sharing platforms. There are various kind of companies, startup companies that are now creating and understanding there's got to be a way to develop a drug in an expedite the path to that development. Let it be 7 to 8 years as opposed to 15 years and $2 billion of capital being deployed into that. So this is actually going back to the Export Institute. These are all complementary, all of those platforms, innovation platforms. And whatever I've been doing on behalf of the Export Institute, which is a semi-governmental position, I've been working closely with the Ministry of Economy in Israel and like 30 to 40 commercial attachés around the world, invited into conferences. I've been speaking in various conferences about the Israeli landscape in digital health and others, having some national booth, at the HIMSS, for instance, and which was an initiative that we have launched, having like 30, 40 startup companies in digital health related, coming out under the Israeli Export Institute operation. So on one hand, you create a critical mass of companies going to the HIMSS for that matter. And on the other, on a case by case, we're trying to develop some kind of a strategy. What are those companies that we have in Israel? What are the challenges that they are falling into? Is it when they go to the Asian market, when they go to the US market? Is it, lack of capital? Is it strategic partnership? Is it regulation? Can we help them in addressing that? Can we help them in deploying capital on behalf of the Israeli government, the Innovation Authority, which is doing wonders for so many years, and companies, we mentioned Mazor Robotics for that matter, and other companies that came out of Israel and were sold to corporates for sometimes over $1 billion and even more than that, obviously. But it's the ecosystem which I've mentioned before on one hand, and the ability to support those companies, it's all actually complementary. It's all helping Sanara, for introducing delegations that we've been hosting, delegations from Japan, from the US, from Europe, through the Export Institute. Eventually, there's so much knowledge resides within the Israeli landscape, as opposed to what I said before, not just the product market fit, but let's say we were looking to do something in oncology, and I've been asking my CTO, go and talk to these two CEOs within the Israeli landscape, because they already did a deal with, the Eli Lillys of the world, with the Pfizers of the world, the Genentech of the world, or the Sanufis, and how you structure a deal, a licensing deal, if you want to go into some kind of a licensing mode. So there's a lot of knowledge, not just clinical knowledge, but rather, how to do those deals in a better way than it was done like 10, 15 years ago. This is why I feel the local ecosystem, but also the global ecosystem, we have to play a different ball game. We have to be more tuned to one another. And I totally understand, I'm not naive, I totally understand there are egos related, there are interest related, obviously, but there are platforms which are building up a knowledge sharing platform, one of which I talk again and again about is one, I hope it's still active in Norway. But this is a good example. There was one night, like 5 years ago, that I was searching just to improve one of my presentation about healthcare innovation. And I've been searching for something for open innovation platform. And all of a sudden, I stumbled into a company in Norway, which is called Induct. I'm not sure that they are still active, but they've been active for quite some time. Whatever they do, it's a connected web-based platform connecting 81 hospitals in Norway. And once there is an implementation of innovation, both technology as well as the process, as well as a payment potentially. And for instance, one of the examples that I remember in Oslo University Hospital, they were able to cut down diagnostic of breast cancer from diagnostic to treatment from 12 weeks to 1 week. So imagine how many lives you will be able to save. What's the cost saving related to that? Once they did so, utilizing a new technology and a new process, they put it on this Induct web-based platform, and they did share it with 80 other hospitals in Norway. So there's no need to invent the wheel again and again, even though I'm a venture capitalist and I like those disruptive inventions, right? But on the other hand, parallel to that, knowledge sharing platforms such as the Induct, and this has been supported by the Norwegian government. So obviously there are interests and hospitals which may not want to cooperate with one another because it's their own knowledge. But once you get some kind of accreditation by the government and you get the incentives to do so, and all of a sudden it becomes the best practice, or all of a sudden it becomes the gold standard of, this hospital, like up in the north of Israel, all of a sudden they found a new process, let it be in oncology or in something else, and then one in the south part of Israel will adopt it. And with that, we can do so much more, not just to save people's life, which is the number one mandate for physicians and all of us in the industry, or obviously to make money on the other end, or to save money, depends on the technologies. But these are the things that I believe will expedite, as well as sharing the data in some cases. And despite the restrictions and despite the privacy issues and the HIPAA compliance and all of those things, I take those into consideration. But still, there are there's an ability to do knowledge sharing platform. I'll give you, if I may, I'm enthusiastic about it. If
No,
I may,
I want you to. No, absolutely. And just a quick, yeah. Oh, actually, you go first, and then I'll go because there's a follow on. I want to ask you about this. Go for it.
One more,
we might be thinking about the same thing.
One more example that just to illustrate whatever I'm referring to. I have a friend that I got to know like maybe 2 or 3 years ago in Paris, in one of the conferences. Her name is Victoria. She's Danish. She built a company, startup company, one of those knowledge sharing platforms, which I was not aware of, but I got so excited because it's exactly was addressing whatever I was talking just now. She actually, she had a rare autoimmune disease, I think, around the age of 30, and it was threatening her life. And eventually, after a long process, she was able to find one clinic with one physician that was doing a research, 27 years research of about these experimental drugs, and eventually saved their lives. When they start to speak about it, eventually they decided to collaborate, and she was, she's okay now. But that discussion actually led to the understanding that actually there's been 7 of those places worldwide which were not aware of one another. And actually, when she introduced them, after she got to know that fact, and they started to speak with one another, and they were actually searching and researching for that rare autoimmune disease with different focus and different aspects of that. And they've been talking to one another and eventually saying, if we would have been working together, it would have taken us 7 years as opposed to 27 years to get to that experimental drug. And I heard that story. Now she did a startup. She built a startup in Europe, which is actually connecting research institutions and helping them. Exactly that. This is what I'm talking about. But it's not just the startup. It's not. I'm talking both on the government level, on corporate level, on organization and others. These are just examples, and this is why I'm so passionate about it. Regardless to my venture capital investment, about us as an industry and our contribution will be much higher, and will be eventually helping one another, this local village, human global village, by acknowledging the fact that knowledge sharing resides within us. Let it be the Israeli ecosystem, the global ecosystem, the European one, talking to one another on the parking zone, on whatever diseases could really, really be in a different level than we do today. No, this was a long pitch. I apologize.
No. There's no need to apply. Hey, I had you on the show. People want to hear from you, right? The question I was going to ask is, so like, I love everything you just said, and I completely agree. I think there's something magical that happens when you receive certain information or knowledge, right? Your exposure to it and the level of awareness that opens up. It's kind of, this is why I tell people, I'm like, you need to read very broadly and read more books faster. Like, there's a Pareto principle you can apply to books. 20% of the whole, you get 80% of the value. Because I feel like knowledge, sometimes, like, let's say you're in a dark room. I think this is why, like, I think therapy is really good, or coaching. You can be in this dark room and you're looking for a switch to turn on. That knowledge allows you to guide your hand to find that switch sooner and flip it on and find all these things in that room that already existed. You just didn't know. The founder of Brain Lab, Stefan Verschmeyer, was on the show recently. I haven't published this episode yet, but he said something very interesting. He said that for every single problem in the world, by the fact that it exists, the solution already exists. By the fact that the problem already exists. And I think that knowledge is kind of the key to unlocking that. The question I was going to ask you is that there's somewhere that I was reading in my research that you started this, I think it was a tech emerge platform. Am I correct in saying that?
Yeah, with the World Bank, yeah.
Yeah. Did that happen after you found this Norwegian one, or like how did that come about? Like, tell us a little bit about that.
So you've been saying about us, and I've been, also addressing your question about us finding ourselves, in those various converging verticals within our lives eventually. So the World Bank actually, aside from looking for equity investments in Israel, for those to address growth markets, we started back at the time with the head of the venture capital team, an amazing friend of mine called Nikunj, and his second in command named Rusgar, both amazing people who've been running the venture capital team for the IFC, for the International Finance Corporation. We've been contemplating about a platform for innovation, to embrace innovation. It was decided that it will be in India. And eventually the World Bank is supportive of, Indian hospitals like, I don't want to quote anything, but I think about $2 billion every year, like designated to life science investment. In some cases, it has been like $2 billion, for infrastructure, hospitals in growth markets such as in India, or supporting by giving them loans on behalf of the World Bank. And the close relationship with the World Bank of hospitals in India like Apollo, Fortis Max, and others. This is when we went down to India, my friend and I, Ruzgar, and actually kind of started what is called Tech Emerge today, and built a platform to bring in, to do, call for information of 400 companies worldwide to address local needs. Could be cervical cancer. Women in India are just dying because of distances and the inability to come to do the test again and again. Malaria, telemedicine, whatever it may be that addresses those markets. And eventually we brought and we called upon 400 companies worldwide, and we scrutinized them, and eventually had been chosen, like 40 companies were chosen to come to meet the Indian hospitals, all of which supported by the World Bank. They knew us. We introduced them to. We brought in few governments to build like a donors fund to subsidize and to incentivize those hospitals to do pilots in a faster way, not to wait for 12 months, but rather if you do it within the pilot within the next six months, $300,000, whatever, you get 50% discounts. Or 50%, subsidies from this donors fund. The Israeli government has also participated, the Finnish government, if I'm not mistaken, and others. So we had some money to subsidize and accelerate the adaptation process. But it was amazing, I have to say, when we eventually, it took us some years to build it up. And eventually there was an event in Delhi, in India, that we came in, and I had almost tears in my eyes. I've been looking into 40 tables, hospitals and entrepreneurship teams from New Zealand, Spain, Germany, Israel, US, been sitting together and presenting to the Indian hospitals innovative technologies which are out there. There's no need to, this is not early stage companies. Those companies were on commercial phase already. And they utilize that platform to show the Indian hospitals what they can do and help them. And basically it's a win-win for both. Eventually, I think there's been like 25 pilots that we did in India. If I'm not mistaken about the numbers, about at least 15 commercial agreements came from solutions to save people and to cut down the costs just by building up an innovation platform and introducing them and matchmaking them. And later on, we took it down to Brazil, to Sao Paulo. And I think after that, it grew up also to Africa and a few other places. So this is when I'm talking about global innovation platform. It is doable. It needs persistence and not to give up and continue more and more. It took us like 3 years to build that platform. But eventually, when you can embrace those technologies by a known organization on behalf of the World Bank, on behalf of Apollo in India, then again, it's doable. You just need to insist on building that up. If you build it, they will come. As they say in the Kevin Costner movie, in the Fields of Dreams, if you build it, they will come. If you build those platforms, the startups and the technologies and the solutions will eventually come.
Yeah, absolutely. But with good marketing, it's very important. Because I always debate this with my friends in Silicon Valley, because they're very big on if you build it, they will come. I'm like, yes, but you have to market it too, because otherwise it's going to take a long time. Before I want to talk a little bit about Sanara's investment thesis and some of the details of the fund. But I have a book recommendation to you if you haven't read it already, but I think you'd really enjoy it. So are you familiar with the technologist Marshall McLuhan? He did the whole the medium is the message. Have you heard of this, Marshall McLuhan? So no. Marshall McLuhan was he wrote about technology and the effect of media on human society over 50 years ago. And he was right about everything. I mean, this guy was brilliant. But he wrote a book, and I'll send it to get the link and send it to you, called The Global Village. And so, but this is before the internet. And his whole thing is at some point, modern society will be connected as a global village, right? To share information, influence each other, so on and so forth. And based on a lot of things you talked about, I think you got to read that book. You'll love it, especially as a technologist and everything. And we keep talking about, it takes a village. The global village is definitely a concept you should learn about. I'll send it to you. So
yeah.
But quick, just wanted. Oh, go ahead. Sorry.
No, what I was saying is that this is parallel to being a venture capitalist. There's so much that could be done to accelerate and help venture capital investments as well. And those were just examples of things that we do parallel on behalf of the Israeli government, on behalf of the World Bank, whatever it may be. But I'm as you can hear, I'm a strong believer, and specifically that is a good timing, because we've been hit with the COVID-19 as unfortunately so many people passed away, and hospitals in so many places are still bleeding from that pandemic. And unfortunately, we may, in a few years' time, we may get to something of that nature again. We have to act differently. We cannot just keep on duplicating the status quo. We should not in life science, when we're talking about people's lives. Everybody has a father, a mother, a sister, or a child. We cannot duplicate the status quo again and again and hope for the best. We need to change the status quo and then hope for the best.
Let me ask you about that. And by the way, I want to be mindful of time because it is late there. Are we good on time?
Yeah,
you doing okay? You're having fun. I can't reveal the guest yet, but I'm having someone on who used to be in our industry, COO, CTO in robotics, and he's now in a different industry. And we had this discussion where he said, he's like, Omar, I hate to say it. He's like, you would think that there's a lot of great innovation in healthcare, but when you compare it to other industries, it's like not at all. Me personally, I won't mention companies or anything because people will figure out who I'm talking about. I feel like there is a duplication of status quo so often in this industry, at least the last 10 or 15 years. There's certain technologies. Again, I'll describe it. You'll probably know what I'm talking about. Certain technology comes out, changes the paradigm of how a therapy is done, a procedure, etc. And then there are 10 or 15 other companies that come out replicating the exact same technology with just tiny incremental benefits. How do we get out of this as a life science industry? Because I feel like maybe 10 years ago that worked where, you could be a second or third company in the market, have a little incremental benefit. And it's like, well, one of the big strategics will buy us and we'll have a good exit. You can't that doesn't work anymore. How do we get out of this mentality and culture as an industry?
Yeah, just for me to explain, when I was saying not to duplicate the status quo, this is not so much on the technology side, even though I agree with you. In some cases,
it goes beyond that, though, right? It's the mentality, everything.
It's the conservative market. It's the infrastructure, the providers, the payers, everybody who plays in that. The entrepreneurs are trying to change the status quo. In most cases, maybe they did not bring the best or the most disruptive technologies, but duplicating the status quo. I'm talking about governments. I'm talking about corporates. I'm talking about hospitals. I'm talking about conferences. Join forces in some conferences, like in Israel. I was trying to initiate, to merge the three major conferences in Israel and to create the JP Morgan of Israel. Instead of having, people flying into Israel, 2-3 times a year, there's no way they're going to come to, a medical conference in Israel. So this is what I'm thinking about the options of creating a critical mass and changing the status quo, whatever, governments, corporates, hospitals, and others. This is an entrepreneurship, within the entrepreneurship landscape. I did see every now and then some solutions, but it's just they did not prepare their homework quite well. I don't think that they came up with, we're going to duplicate it and be succeeded. I think that they just came up with some kind of innovation and they did not do their homework quite well and understanding the competition and who is out there and try to come up with a better, unique value proposition. But it does happen every now and then. You see, we've been seeing companies for optimization of clinical studies. I've been seeing quite a few companies on optimization of clinical studies. And they each and every one of them has a strong belief that whatever they present, maybe from their own expertise or experience within some pharma companies, this could be the best solution because their pain and the solution that came as a result of that pain is something that they believe quite strongly. Maybe it's not disruptive enough. Maybe it's not going to be successful. But, I'd rather to see people inventing and creating and trying to come back again and again. What we're trying to do, and you asked me a little bit about our strategy as Sanara, we're trying to bring value. I have a team in the two funds of 12 people and venture partners in the US and in Asia. My partner in the US, Andre, and my partner in China, Haisong, and my partner in Europe, two partners in Europe, Daniel and FP, and the team in Israel, obviously. What we're trying to do is even if we do not invest, we're trying to give our feedback, a strong feedback as to what those companies should be doing. And hopefully they will come back to us within 3 to 6 months or whatever. And they will, and in most cases, they did come back differently and they did check and they did learn and they did come up with a new, kind of a validation of such and such or thoughts, food for thoughts as to some feedbacks. I think this is our job, not just to invest and send companies, the other that we do not invest in, send them their way, but rather, contribute to the industry, the knowledge, and sometimes the mistakes, and make sure that they get a strong feedback. And this is why I feel Sanara has a good reputation by entrepreneurs saying, we were here like 3-4 months ago when we decided to come back. And even though we said no in the initial phase, it may be different.
Yeah. And, maybe, and I was going to say, this is, I wanted to ask this specifically about Sanara. With Philips and Teva as the joint venture, I know that you focus a lot on MedTech and digital health, but the part that I want to talk about, again, theme of this whole talk here, a lot of it was essentially convergence of knowledge, technology, and everything, is this concept of bioconvergence, right? And you spoke about it recently. I can't remember where it was, but you were talking about the idea that you cross the frontier of biology using other disciplines of converging them. But can you talk a little bit, like, what does bioconvergence mean to you, and why is that something that an LP should be interested in having in their portfolio of investments?
Well, it's a tough one. Basically, with venture capital, it's a high risk, high reward play. This is to start with. As a venture capitalist, you take risk. It's not a CD or whatever that you put in the bank and the interest. But in bioconvergence technologies, and we grew on that. I have to say, it wasn't easy initially to swallow and digest. When the Israel Innovation Authority came up and said bioconvergence, parallel to digital health, will be the next revenue generator in the life science industry for the state of Israel. And eventually, then we look into 4 or 5 of our investments, such as the company that I've been telling you about, nanodrops, the drops in your eyes to replace lenses and glasses. Basically, there's a laser flash that creates a pattern on your cornea, which is the physics component. And then the drops is biology, which activates that solution for myopia and presbyopia. But it's the convergence of biology and physics that enabled that disruption to come into play. Without the convergence of these two, there would not be such an amazing solution. This could be implemented in drug delivery. This could be implemented in diagnostic. Eventually, you may be able to see a diagnostic device, like one that we invested in, can do, like a PCR, diagnostics of germs or viruses, but a sample to result within like a minute or two. It's like a PCR instead of like 2 hours, 4 hours, whatever it may be. The technology behind it, that within that diagnostic device, is actually a bioconvergence technologies. It's a manipulation that we do on biology through some physics equations and others, but the enabling technology within those products or software, computational biology for that matter, would be defined as bioconvergence. And it could be tiny robots for drug delivery and crossing the blood-brain barrier to treat degenerative diseases, or it could be 3D printing of organs. So the implementations and applications of bioconvergence may be in different verticals, in different fields. By the way, not just in healthcare. I know that Merck, I've been reading a piece of the CEO of Merck saying, that's the next big thing in the medical space. Bioconvergence, the ability, and those are, science fiction to some extent. And going back to your question, we as venture capitalists, we need to mitigate to some extent and not just to deploy capital in fascinating technologies which are lacking, the science behind it, or lacking, the validation of such and such in order to bring it to the marketplace. But on the other, if they do, those might be huge exits, because there's a huge barrier to entries in those very disruptive, complicated technologies, which as you've been mentioning, the other players will not be able to duplicate the same technology. If it's truly a bioconvergence, there will be a unique barrier to entry, a unique know-how, which will not be easy to duplicate. And as such, corporates will eventually buy those technologies. This is our belief, even in some cases in an earlier stage than others, because the depth of the technologies and the disruptiveness that they can bring to the marketplace.
Yeah, I agree. And I think, this is kind of like splitting hairs, but I think, based on what you're saying, the way I see, if you look at biotech and medtech, I kind of feel like medtech is obviously, you have to have some hardware, some devices involved, but it's enabled, through data, algorithms, and everything. That's medtech, so like there are some companies I work with, they're not medtech. They're a medical device, but they're not medtech. Biotech, and the other side on medtech is that you can have something like, let's say, a surgical robot, for example, that works, but like you still have some flexibility to say, oh, we deployed it, it's being used, but like there's some ways we can prove it. In biotech, it's very like black and white. It's like either the science works or it doesn't. Would you describe, it feels like you take like the certainty that's needed from biotech, but with some flexibility they have in medtech and putting those things together. And that's kind of like a device or innovation, like this company that you mentioned with the eye drops, right? What are some other examples of like bioconvergence companies, maybe that your fund has invested in, but they're like really, really good examples of not just a great investment, but like groundbreaking investment, for innovation?
I will give another example from one of the companies that we did invest, a company called OncoDecipher. This is actually a company that we've spotted like 4 or 5 years ago out of Tel Aviv University, and it's actually has to do with oncology and the silent mutations. Typically, in the process of cancer tumors or oncology, when people are being checked to see if they are properly fit for immunotherapy, you send the samples to companies such as Foundation and others, Foundation One and others, and basically then eventually at the end of the day, merely like I would say 10% of the people are relevant for immunotherapy because of those tests being conducted on the genetic side. Now, OncoDecipher, the company that we invested in, still in the early stage, I have to say, not from the fund, but rather from our incubator fund, not from the post-incubation fund, Sanara Capital, is fascinating because they are doing a unique set of algorithms to understand the outcomes of silent mutations, whereby are not being scrutinized today. These are the peripheries of science or of the practice of medicine or the treatment of medicine, immunotherapy at the moment. And eventually they can predict whether a specific patient, will develop or will have a relapse of a cancer tumor. And the application behind it is to allow pharma companies to do indication expansion. So to treat, basically, instead of those 10% that I've mentioned before, maybe to treat 13 or 14% of the population through those enabling tools and sophisticated computational biology, by the understanding of the mechanism and the metabolism within those silent mutations, which are not being under the radar of no one's today. That's the beauty. This is something that we love. Whether it's going to be successful or not, I'm not sure. I don't want to say it again, but like getting excited, sometimes being in that field, I got the proof of concept of 3 silent mutations that we have looked into like 4 or 5 months ago for my CTO. I got a text message, a WhatsApp message, and I read it again. I just called him up and said, is this finally, after 4 years, identifying that in a TTO of Tel Aviv University, licensing that, building up a company, investing $1 million, basically deciding on the first 3 mutations and running using CRISPR, the first ever for this company, the proof of concept. And eventually we were able to reduce the expression of those, of what was about to become a cancer tumor with existing drugs. And I told him, is it like truly a proof of concept? He said, it is, my CTO, it is, Dr. Eran Toledo. And I was so excited, whether it's going to be successful or not, but it's only through that very unique algorithm and very sophisticated algorithm and big data that we now these days are able to give a chance to that technology and so many other companies and startup and VCs, through unique sets of algorithm and AI. Now we are able to give a chance to things which we were unable to do, let's say 5-6 years ago.
Yeah, that's amazing. And I think I tell people, I think it's such an exciting time to be in our industry because, again, like theme of this talk is convergence, but, you have, tech entering in, which is not just going to bring different types of innovation, but like different ways of thinking of how do we sell and market with customers? How do we drive customer success, right? Because it's not enough just to have really good technology. You have to deploy it to the user. And the benefit, what I feel like makes healthcare so unique but difficult is we all create products that's going to benefit a patient, but the patient's not using it. There's an intermediary, whether it's a nurse or physician, everything. So it makes it more interesting. But then also we have of course, LLMs, machine learning, not machine learning, but large language models like ChatGPT that are available now. And so who knows how certain MedTech companies are going to use that, right, to develop certain technologies, innovations. Right now, you're going to LSI Europe soon, and we talked about it's such a great conference. And again, I'm gonna pressure you to try and make sure to come to LSI USA next year because it's even. Well, LSI Europe is great, but I don't want to take anything away from there. But I love LSI USA. Going to LSI Europe, what are the kind of things that you're is there anything specific that's sort of top of mind for you that you're looking for What's kind of got your attention these days?
Basically, some of those conferences, they provide the true value. I'm going to be coming to LSI Europe with one of our portfolio companies that we invested in the fund in Sanara Capital, a company called CV8. It's a stroke detection company, actually. And they are doing, actually, before a CT scan, people are getting stroke. And by the way, now in Asia, I came back, I had a trip or two to Asia, and I've been hearing about a new phenomenon of young adults, like at the age of 40, who are getting stroke, typically, considered to be like elderly people and whatever, not necessarily in all of the cases. But people are getting stroke and eventually being diagnosed with a stroke. I mean, if you have your lips falling down, you know that there's a stroke situation. And even in the EMS services, they will refer you hopefully to the right hospital who can do thrombectomy and maybe treat you properly in the best manner of time. Nonetheless, in so many cases, people go to the ER in various places on the planet, and eventually they wait till a CT scan is been taken, and only then they've been diagnosed with a stroke. And in some cases, this is way too late because in a stroke situation, time is brain. You have like 3 hours to 3.5 or 4 hours, the latest, in order to treat the brain. So with that, both the EMS services, knowing if this is a stroke situation, and definitely in the ER before the CT scan is being held, if you can put an app on the patient's face and like a nurse talk to him and say, hey, can you touch your nose? Can you smile? And even though if the human eye will not be able to see the asymmetrical movement of our muscles, that AI system of CV8 will be able to, within 5 to 10 seconds, to tell the physician or the nurse there's a stroke situation here, send him quickly now, not wait 2 or 3 hours to the CT scan and potentially do a thrombectomy or treat him with a drug. This is one of our companies that are now conducting clinical studies both in Barcelona and in the US. And I find it quite interesting because they are about to start a fundraising process in the next few months. And I thought, one of my goals, aside from speaking there at conference, is to start to talk to some VCs and potentially to some strategic partners and others who might be interested in such a solution. So maybe this is merely just an example of one of our investments, but I honestly believe, in some cases, the more you talk and the more you shape and iron the offering as a startup company with those VCs, and others, this is something that you have to take into consideration as 6 to 8 months, which were typically, an estimated time for a fundraising process. Now it may not be enough. So you have to build those relationships, meet them, this VC, maybe a year in advance, present them, then come up and say, hey, we have achieved that milestone and that milestone. Now we are here. And going back to what I said before, those relationships, building up the trust, not just within 6 months or 3 months and getting a term sheet. This will not be enough these days. And I recommend to those entrepreneurs and startups, to do the efforts and to take those the means and the resources into consideration of, even if they're not starting right here, right now, fundraising process, but they come and they talk and they build up the relationship and they meet and they get the feedbacks and they come again to another conference after, a few months and they do present the outcomes. This is much better off and has better chances to fundraise than rather just give it like a quick chance as we used to do, like up to a year or a year and a half ago. Those are cycles. The VC cycle is always cyclical, and this is a nature. But when you are within those cycles, you need to adjust. We as investors and so as companies, and they need to react differently to build up those relationships. And come again, and not to be afraid to be rejected in the first time, and come again with better results and better outcomes and better understanding of the marketplace.
I absolutely agree. And I think that this is one thing that a lot of founders, so I work with a lot of CEOs and startups in their fundraising process. Like my very, very, very first company I worked with, which I always point to as a great example because they did everything they were supposed to because they have a great CEO, is Moon Surgical. And, Moon, they raised $30 million as a Series A. Then recently, not only did they raise $54 million, they got Fred Moll, who's the founder of Intuitive, on their board. NVIDIA and Sophie Nova partners led their Series B. But I think part of the reason why is just there's a lot of skepticism around their technology at first because it's it's another robotic company. But because they were very proactive, engaging with the market, not only just posting randomly, posting on social media, but going on podcasts, allowing time for people to digest and understand what they're doing, and also showing the traction, right?
Exactly.
I think like for, I tell founders all the time, because sometimes like it's hard to raise money only on the innovation alone. It's like, look, put yourself in the shoes of a VC who's trying to deploy money effectively for an LP. One of the things that they want to do is de-risk it. How do you de-risk something? Show that you have some market traction. And a lot of times, founders are like, well, we're pre-commercial, we can't do that. I'm like, well, you should be creative about it. Like, can you get letters of intent? Can you show like, hey, here's a list of 10 hospitals, 10 KOLs we had meetings with, and they're all like, yeah, we're very interested. So I think, again, like the quality questions you ask yourself will generate more creative answers. But you're absolutely right, which is within these cycles, I think that there's this, in a lot of new founders and entrepreneurs' minds, they think of like what they see in the movie. It's like, oh, you have a really good pitch deck, you go and pitch the VC, and then like you just follow up and then you get the money. And you can't do that anymore, because there's more you're getting. I can't imagine what your inbox is looking like. So like you by yourself and your team have a lot to go through just to evaluate, do your due diligence and everything. That's not going to happen in a week. Because sometimes it feels like if you need to raise money a year from now, you have to start marketing and doing all these things from now. So there's like time to digest that, right? Would you agree with that?
Totally. Exactly what I was referring before. Those are different times. We started that maybe over a year ago. Generally speaking, as I said before, it happens every few years, whether the capital markets, whatever the recession, whatever it may be the reasons, but it's also obviously impacting the VC community. And we've been seeing the drop of investments by VCs and others, some of which are focusing on their existing portfolio and not making new rounds of investment just because. And some do, but in a different phase, and different, in some cases, different structures even. But this is don't be afraid as an entrepreneur. Don't be afraid to be rejected, even if you need the capital. If you still have the capital for a year, do a sanity check and keep those VCs that you've been in contact with updated, and understand that this is the way you build trust and transparency and acknowledgement, and you show the openness that you are open to get some feedbacks. You are open to be rejected. You're not afraid to come over and over again and to try again. This is okay, as opposed to keeping like the last 6 months till you're running out of any ability to take the company with the burn rates to another 3 or 4 or 5 months, which will be needed for fundraising. So those are different timelines of fundraising, and it's okay to play differently in those times.
No, absolutely. Any advice? Maybe I'm sure you have some advice here, but is there an example of an entrepreneur that or company that you rejected maybe once or twice, but then you ended up investing in? Like, if so, like what changed? Like, is there one that kind of comes to mind for you?
Actually, the one that I just spoke about, CVA, the stroke detection company, it was initially, and it may sound like not such a crucial, but it was crucial back at the time. The business model, which I was trying to emphasize before that, when they initially came to us, first of all, they were quite young, but the reason that we said no to them, it was they were looking to, the best, the most understandable, I would say, value would be once in the EMS, once in the ambulances, and you need to know where to refer the patients. So using that technology, you would say, instead of going to, whatever hospital it may be, go to this hospital because the patient is suffering from stroke. Then again, before a CT scan, by the understanding of the paramedic. And actually that business model, which they presented in EMS services, when we did our, checks and due diligence, it was not enough. There's merely, maybe even today, I would probably claim the same thing. There's not much of money for those EMS services to buy and be equipped with new technologies and to implement, even though it's a life-saving technology potentially. And, the rehabilitation after a stroke situation, costs related to the government could be huge by implementing such new technologies using AI and others. But because of their business model back at the time, they insisted on that because, they felt that while getting to the ER, which now when they came again to us, it's, there's less of a unique value, a clinical value, which apparently there isn't. They got some strong feedbacks from various hospitals as to the uniqueness of the technology, as to the value of the technology. There's still a business case which needs to be built properly, obviously, but it's just that, it's just within the process, whether we should come up and justify and protect it, or whether we adjust and come up again to those investors such as Sanara and saying, now we have adjusted our business model, we shall, both for validation purposes as well as for the business model to justify the ability to pay, would be to start with hospitals and not with patients' home, neither even with ambulances, as initially as a B2C or a B2B play to ambulances or patients' home, and do the diagnostic over there. So this is a good example.
Interesting. Yeah, and I think that's it's good to hear that, because I think a lot of times again, the founders who are going to listen to this are going to benefit from your advice. Is that especially those founders who are going to go to LSI, sometimes they're looking to get everything done and like walk away from LSI saying like, oh, I raised this, which does happen. It does, like, I know companies have gone to LSI and like that week they're able to get a few checks written to them, but most of the time that just doesn't happen. And a lot of times, like, it's like a plane taking off from Israel going to I don't know, to London or something. If you hit a little bit of turbulence, you don't turn the plane back and then go back to your to where you started. It's like, you hit a little bit of turbulence, you just kind of adjust course. So I think that a lot of times when founders go to like an LSI, or they have a meeting with you and Sonar Ventures, that they got to take this feedback and then go back and say, okay, it's just like with product. If you come up with a product like a robot, surgeon uses it, they're going to tell you like, this could be better. You don't go and just say, oh, we're just going to scrap the whole robot, right? You just go and adjust it, right? Because it's a product. Same thing in this case, like it's a product for investors, right? So it's like customer feedback at these kind of events where you're like, oh, our customer here is an investor. We got to go back and work on this investment product so they feel better, buying it,
Yeah. But on the other hand, let's just be honest and do, describe the other scenario whereby in some cases entrepreneurs do stumble into a wall where they got a no from investors and saying, this is not a proper business model, or this is not a product, this is not a sellable product. It may interfere with the workflow of the physicians. It may be, and in some cases, and we do meet some of those entrepreneurs that are falling in love with those technologies, not even with the product, a core technology. It's not always a product, and definitely not a successful one. And then they need to go back and listen again, and don't, not to be offended, and going back to the drawing board or do a market research and find the right use case, which will be eventually the right use cases. I mean, companies were saved by identifying, in some cases, the very last minute of the right use case for a certain technology. And this is there's a company out of Israel called Itamar Medical that eventually was sold.
Oh, it was a great story.
For $500 million, and only when they
to ResMed, right? Was it ResMed? No. I think maybe Siemens. Hold on. I'm gonna look it up. They were, sorry. Please finish your thought while I. Zoll acquired them.
Zoll, exactly.
There we go.
Right. For $530 million, whatever. But they've been doing like a probe on the finger for sleep disorders, basically. And they've been trying to replace, when we go to a sleep lab and whatever, it's uncomfortable, whatever. Initially, they've been looking to do that at patients' home and to set the technologies, hoping that people will, eventually will find or will be better off with doing those sleep apnea disorder tests at the patient's home or in those clinics. But eventually, when they understood that those sleep disorders do cause some cardiac issues, they've been shifting actually and looking into the cardiology space, and cardiologists been trying to now adopt that solution and buying that solution as part of their practice. And this is what changed the companies, and sales started to grow. It sounds like a tiny, or it may not sound a tiny, but it may sound sleep disorder, but those are different fields and different people, different stakeholders and different decision makers, and that's changed the whole picture.
Absolutely. Yeah. And, I'm glad you mentioned that. I should probably do some episode on this, but there isn't, I really feel like there's, even me as a, I didn't raise money for my company, but whether you're venture backed or you're, bootstrapped or a small business owner or something, there's something to be said about the art of introspection and intuition to pivot. So Intamar is one. My favorite example of this, at least in our industry, is Intuitive. Intuitive came out and they had a robot that was for specifically, it started with like cardiac surgery, right? And they were thinking of all these different areas. And there was even internally when they said, "Hey, I think we should go after the prostate." There was internally some people that didn't want to do that. They're like, "There's nothing sexy about that." I don't want to. I think somebody even said like, "We're gonna be like a pee robot." Like, I don't want to do it. But that shift made it this billion-dollar behemoth. Same thing. Auris, the company, that was the largest robotic acquisition in history. They started out actually as a robot for ophthalmology, I believe, and then they made this pivot through a product. Jeff Alvarez, he's a product VP of product. Now he's chief strategy officer. I mean, he's going to be on the show soon. He kind of had this whole case to the board about why we should focus on the lungs, right? I think there's this art behind like saying, hey, we're going to have a thesis. And maybe I would imagine it's the same for VCs. You have a thesis, you deploy the thesis, and you say, let's see what happens in the market, like in the real world. And we've been simulating it. Let's see what happens in the real world. And then take those data points and say, here's how we're going to shift and change the thesis. Do you feel like the great startups and entrepreneurs, that's how they sort of approach things?
So going back to maybe to dive into that a bit better, this is exactly the art of listening in my eyes. And being able to acknowledge reality as is. So initially I was saying, we do meet, and I see a lot of entrepreneurs, maybe specifically Israelis, but I don't want to, criticize necessarily just Israelis, but it's this phenomenon which I talk quite freely about, and I think I'm not mistaken by the fact that let's put it on Israeli entrepreneurs. There's a lot of abilities, some of which came out of the Israeli army with the best army units, intelligence, and whatever, and they have a lot of confidence, some of which have been repeated serial entrepreneurs that did some exits and coming back to the marketplace. But generally speaking, there would be also a lot of entrepreneurs that eventually the process of selling and selling and selling would be the major process, or the major, I would say, characteristics of that session that they will do with the market, of kind of listening to the market and shaping up their product. While the process should be, or the ability should be vice versa, should be kind of take it inside and listen more than just try to sell outside. This is a major issues that have saved so many companies. I had the CEO, and this is a story that obviously without names, that was one of our companies using AI for some kind of an application that was traveling to the West Coast. And it's quite a distance to go from Israel, from Tel Aviv to the West Coast. And I've been hinting up to him and saying, you're trying to fundraise. He's been a high-tech person. And I've been telling him, you're trying to, this is a long distance. Why don't you do a sanity check with local VCs? And why you need to go to the West Coast so much? It's costly. It takes a lot of time, a lot of your energy. And he was, to some extent, I gave him the leeway to do that. I was the chairman of the company. And then only after, a year, he was able to tell me that he got some rejections every now and then. Maybe, the immaturity of the product. But there was one time that someone told him, why are you coming here? You're not a Stanford graduate. and then he was like, he acknowledged that. So I'm not saying whether it was right or wrong. I'm not saying that non-Stanford graduate will be able to fundraise or not, or be able to fundraise in the Silicon Valley or not. I'm just saying the message was there for the few months before, which he was unwilling to listen. He was not willing to listen. And the company was not doing good regardless to that. They were lack the ability of fundraising, but it killed almost like 8 to 10 months, which is a lot in the life cycle.
A lot of time.
It's a lot of traveling and cost related to that. And as opposed to, if he would have listened to us and he would have listened to those feedbacks too early, to this, and eventually those changes that you do, if you do listen carefully and you acknowledge and you see reality as is, could save those companies.
No, I'm so happy you mentioned this. And I feel like there needs to be a book or a series on this, because I feel like there's a lot, when you become an entrepreneur, I feel like all the bad habits and weaknesses you have in your personal life, they will be exposed at scale as an entrepreneur. Big time. And I try and pay attention to that even myself. My business is it'll be 2 years old in January, but I kind of look back and like I was able to identify certain, like, oh, you know what, when I had this problem, it's because in my own personal life, this is how I am, right? And one of the things that I always think about And this is why, like, I'm very open to getting feedback on my business and business model from people who are not in my industry. There's a entrepreneurial, like a mastermind group I'm a part of. None of these guys are in MedTech, but I tell them everything I'm doing because I just need one person to find something. Maybe like 5% of what they say is right, but that's all I need. Because that's like all I need to change things. And I'll share like one personal story. A long time. You have two. How old are your sons?
10 and 12.
Oh, they're really young. Okay, you'll appreciate it. So, I'm married to a wonderful woman. I have a amazing wife, amazing mother. But when I was 29 or 30, I was kind of like, yeah, I think I want to try and settle down. But back then I was single. I had I just left Missouri. I got acquired. I was able to buy like a home, and so I felt like very like successful. I was like, I bought a home in America, great. And my parents, through my aunt, they told me about this girl. They're like, oh, this girl, she's Turkish. So I'm Turkish, and my wife was living in Turkey. You should meet this girl. And I started getting a lot of pressure from my parents. Oh, when are you going to meet her and everything? And I got very angry. I was 29. I was like, I'm not going to meet her. And I remember thinking, like, what do my parents know? Like, they're a little old school. Like I know. And I remember, I don't know what I saw, Assaf, but something hit me. And I said, what if my parents are right? Like, what if they do know what's best for me? Is it going to kill me to listen to them? And so that was the day where I decided, I'm like, let me go like meet this girl. And so she was going to fly to Miami. She was flying to Miami. She worked for the airlines. So we went and met. And, as the saying goes, like the rest is history. But that always stays with me today when I talk to different people. Even now, when I talk to my father, he might say something about my business and I'll get like upset or, maybe I'll be like, no, but I always think, I'm like, would it kill me to consider that? Like, what am I like? Because sometimes especially as an entrepreneur, you get so close to a problem in your business and you're under the influence of so many emotions that you don't see clearly, and sometimes it takes like somebody from outside with experience and intuition and everything, just be like, you should consider this other way. And I feel like so many founders will benefit just from like learning how to think this way,
What's the hardest in some cases? What could be potentially the hardest shot when you take in the game of basketball?
Oh, that's a great question. I don't know I want to guess, but can I? I'm gonna take a guess. Is it the free throw?
Exactly.
Oh, okay.
Why? In some cases, because everybody's quiet. You may be standing in, just yourself with 20,000 people, and it's just you and the awareness and the need to, to actually to put that silence and not to listen to this is not to listen, but rather to listen to yourself and to the hard work that you've been putting into. But it's the in some cases when you do try to listen to some themes that hard work and the ability to be open up to the flow of of the court of the game, not just to focus on yourself. When you do that, this almost an automatic kind of a shot that you should be doing if you can. If you put everything aside, you're getting to be quiet enough and focus enough and listen to yourself. In that case, I've been practicing. I can do it in some cases. I mean, it's not if a 20% gap and the company is winning with no doubts, but it's like the last minute shot or whatever, the foul line. It's such a different flow of the game because so much that we do, as you mentioned, we reject. We don't say this is part of the game. We play. We've been aggressive. This and this. And only when you stop and you listen to yourself, to the crowd, it becomes a different. It takes us from the flow to a different comfort zone. It takes us out of the comfort zone into something which we are not used to. We're not sometimes used to listen to ourselves or used to listen to someone else because we're trying to sell and sell and sell and sell. But this is where it becomes difficult. But this is also, if you do embrace that, the ability to be quiet, the ability to take it upon yourself, to listen to the crowd, listen to yourself, it becomes something else. You've been educating yourself to behave differently, and not within the flow of rejection, of being aggressive, of trying to sell and whatever on the day to day. I think that's an illustration that came to my mind as even though it may be hard initially, but it's something that when you practice it and you practice to listen and more so, you observe the knowledge that resides out there. it's better chances to become successful.
Absolutely. No, absolutely. Assaf, we're getting close to time, and I really appreciate you, spending some time with us. By the way, I'm just going to say this publicly. Like, I know my audience, well, they're going to want to have you back. And so definitely I want to have you back. We'll talk more like, specific topics and everything. Definitely want to have you back on the show. But I have one last question for you. Is it okay?
Sure.
And
Sure.
and I'm going to, and you get to spend, again, I'm good on my time. For you, it's late over there. So here's my, here's my question, and then I'm going to read something. So for me, my first company I worked for was Mazor Robotics. I was exposed early in my career to the way of Israeli innovation. And there's this very unique dynamic where I think every citizen in Israel goes, they go through the military. So you get leadership training, right? So there's that side of it. Then the Israeli mentality, and I can say this because I'm Middle Eastern, which is like very bullish, very like, when you speak to an Israeli, where you stand. Israelis do not hold back, and so there's always, this tension when it comes to innovation, that especially when you're trying to solve a problem. And I remember this at Mazor, is that when I would work with Israelis, we would argue about things, but that tension would force us to get to the source of truth and solve the problem, right? And so here's the quote I want to read to you. So this is from your one of your presidents, Shimon Peres, who said this: Jews' greatest contribution to history is dissatisfaction. We're a nation born discontent. Whatever exists, we believe can be changed for the better. And you started this quote in one of your talks, and I thought it was such an interesting quote. Can you talk to us about this culture of innovation that exists in Israel? Because I want the entrepreneurs who are listening to kind of like somehow adopt some of that mentality. So if you can talk a little bit about this idea that, Israelis, they have this thing of just being discontent and dissatisfied with everything. Can you tell us a little bit about that and what that means to you?
I think that when you look into ecosystem which have a lot of entrepreneurship spirit behind it, those are hubs of innovation. In some cases, it could be related to social mobility. People want to be rich, and this is why they give it a shot, and they spend 3 years. In some other cases, there's no social mobility. Some cultures, some countries, they keep on working and for 20, 30 years in the same place, same job. In Israel, I think it's a combination of the belief in social mobility, the belief of successful stories that, people made it and did a lot of money. But it's more than that. It's not just it's more than that. I think it's something that being a melting pot and being, able to bring, a lot of, past the Holocaust and from various geographies in Europe, in Africa, in Asia, and in the US and others, it's quite a melting pot in Israel, which still has been cooked and boiled to a certain degree where, nobody accepts and everybody fights and everybody argues and everybody thinks that they should be prime ministers. We have 9 million people, so 9 million people believe that each and every one of them should be a prime minister. But when Shimon Peres, the reason that I use that quote is that truly the dissatisfaction. This is it's not just from being rich. It's the dissatisfaction of the status quo, or dissatisfaction when people are dying in hospitals, or people are, suffering in the streets, or people are. I think there's some kind of a level of sensitivity and some kind of a level of that interaction between people. On one side, it may be, and it is to some extent quite aggressive. Israelis are quite aggressive and not just blunt. Some people may say they are just blunt, but in some cases it could be aggressiveness, just because this is the way, as we do either in the Middle East or Mediterranean kind of a culture, kind of a warmth atmosphere. But the dissatisfaction is the ability, combined with the ability to think differently and to believe that you can change for the better and stay away from the status quo and make something happen. And I think the fact that, even in terms of expertise, it's a small country. If you're looking for a surgeon in microsurgery, if you're looking for that and that and that, the expertise resides within relatively a small kind of a neighborhood that you can approach and communicate. You don't need to fly from New York to San Diego to nearby you in order to be able to talk to a specialist. So all of those ingredients, the army, the confidence that people getting in the army, the ability to think out of the box and to change the status quo, and the dissatisfaction, as Shimon Peres said, this is all part of the culture, the DNA within the Israeli landscape. And I've been seeing, I'm quite, traveling quite a bit. I've been seeing, kind of weird teams of maybe one of the airlines pilots is also an entrepreneur in one of the medical companies. He's been talking to me, hey, we approach you guys in Sanara. And I'm like, he's both flying a Dreamliner, a 787 kind of an aircraft, and he's been an entrepreneur in the medical field. Like this combination, that convergence that everybody needs to be part of. And now there's a lot of politics in Israel, but this is regardless to that point. But on Friday evening, this is not just politics. You will be talking to everybody. Everybody somehow has been dragged in part of a startup company, which is quite amazing in Israel. It's quite amazing to see that somehow almost everybody is somehow involved in startups, whether as a consultant or as a team member. And this is why it's such a vibrant ecosystem. It's hard to explain, both cultural as well as eventually it became a DNA. It became a DNA of the Israeli culture to create, to change, and to come up with new companies, new startup companies.
Wow, that's amazing. Well, I have a bias towards U.S. companies because I'm here in America, but believe it or not, a lot of people, young people who I mentor who start at MedTech, they're like, what's your recommendations? I always tell them like, well, go work for a startup for sure, and try and find a U.S. one. But if anything, if you can work for an Israeli startup, I was like, it could break you. I said, but it'll make you so much better. And I credit a lot of my success and who I became to the team, but especially the Israeli team that I worked with over at Mazor. So it's been 10 years. I haven't worked for
facing reality. I'm sure that facing reality, because we have to face reality in so many situations. Being the situation of Israel need to fight for its survival for so many years and to come up with innovation. Those are the high level explanations. Necessity is the mother of innovation. This is one of the verticals. Necessity is the mother of innovation, and that created quite a few companies out of Israel. But also that DNA, the culture that we've been talking before.
Oh, absolutely. And, now that I'm running my own thing, I'm looking forward to, helping and working with more Israeli companies. So Assaf, thank you so much for joining us on the show. For those who are interested, I'm going to leave in the show notes. You can, follow Assaf on LinkedIn. Also go check Sanara Ventures website, sanaraventures.com. I'm your host, Omar M. Khateeb. If you haven't reviewed the show, come on, guys. Seriously, you've been listening to this show for a long time and haven't read it. Take a second, leave that 5-star review down below, subscribe, because we do release a lot of episodes that we do not promote. So go ahead and subscribe so you can get those notifications. Leave the reviews, 5 stars, write a review, and we'll see you all next time. Bye for now. Thank you for enjoying another epic episode of The State of MedTech. If you're feeling inspired and love this episode, do us a favor, hit that subscribe button and turn notifications on so you never miss an episode. And be sure to give us 5 stars and write a short review, because that helps more people discover this amazing community of ours. If you're a company who has an executive that you'd like to be on the show, or perhaps you want to sponsor one of the episodes, shoot us an email at hello@khateebandco.com. Take care, and we'll see you next time.